Hello, good day. My name is Franklin Kwano. This presentation is about Kaiser Permanente, a United States company that delivers healthcare, which is non-profit, founded way back in 1945 by Henry Kaiser and Dr. Sidney Garfield. The major issue faced by this organization is the fact that their website is non-functioning, and there are 10 million people which are connected to this. This has highly affected healthcare delivery, making the website unreliable. And also, the dimension in which the organization underperforms can be categorized into three main areas, which is high health equipment malfunctions, inefficient communication, and serious understaffing. These will be explained later in the presentation. Now, replacing human labor with healthcare technological equipment compromise the efficiency of service delivery to the patient, and this is exactly what Kaiser Permanente does. They've replaced a lot of the human labor with health technological equipment, and this has caused understaffing and also has caused technological malfunctioning by the staffs because they are not properly prepared to use this equipment. The possible implications that can be um, gotten from these mistakes, or this downfalls, is the fact that there will be loss of patients and other healthcare seekers. Also, prioritizing technological equipment in service delivery over human health labor may lead to feeling of demotivation and displeasure by the healthcare personnel. Okay, so because as a result of the ineffective communication in the company, as a result of um, high use of technological equipment, is bound to lack operation ideas and information. This inhibits teamwork, human relations. The organization has a structure, a design, and a culture. Now, first of all, let's describe the culture. The organization is composed of three distinct groups as the Kaiser Foundation Hospital, the Kaiser Foundation Health Plan, and then the regional Permanente medical groups. Let's discuss the organizational design. Now, Kaiser is a prepaid integrated health facility which encompasses three absolutely different barcode dependent organizations, as I have said earlier, and that these services consist of insurance risks, family members of health practitioners, and hospital facility. Let's discuss the organizational culture. The culture of Kaiser Permanente is to instill continuous improvement in healthcare services through diligent performance by its workforce. The organization imparts rationality in its workers to enhance the understanding and recognizing systems transitioning in service delivery. On a weekly basis, the head of the organization keeps reminding the whole fraternity of the organization that is meant to celebrate the organization performance progress of the week. The organization culture is also defined by the purpose to sustain its members' trust as well as the trust of the community. The influence of organization effectiveness, how the design, the culture, and the structure of this organization influences the effectiveness of their performance. Now, the structure of the organization reflects the level of its performance. It integrates and fosters its network in service delivery to a wide scope of patients. Also, the design of the organization bears holistic approaches and mechanisms that make it easy to assess and acquire its services by the public. The culture of the entity is based on the improvement of service delivery. The organization imparts a working spirit in its workforce, and it keeps the workforce intact in their performance and aligns them with the organization's need for continuous improvement. Now, how does this integrate the principles and values? Kaiser Permanente designed various principles and values aimed at guiding and fostering excellence in performance as well as a service delivery. Now, this principle is not adequately implemented in systems operation since its website is characterized by regular failure, and so because of that, it makes it very difficult to health service seekers to navigate their healthcare services and find information. Now, Subsequently, another principle which is set by the organization that is not well implemented is a principle of accountability and responsiveness. This is because the organization has increased technological equipment for use, and this is done to cut costs. And because of that, it brings understaffing, and because of the case of understaffing, the principle of accountability and responsiveness is undermined. The website has a capital of more than 10 million enrollees who seek medical health services in different times but cannot reach the services providers due to flawlessness of the website, and also the leading to delays in responses. Now, the relevance in improving the organizational function, how relevant is it for the organization to improve upon its function? By integrating quality performance and services delivery, the organization is destined to attain its purpose. Basically, the members, the users, the community, and partners look up to the organization's superb performance in order to affiliate to it. Now, being responsible and responsive to the members and users' needs makes its existence more compatible with their needs, and therefore merges their interests with the entity's services. Also, having a broad connection to various stakeholders makes it possible to sustain its resources and in operations. Creativity and innovations are closely correlated factors that are integral for the well-being of the Kaiser Permanente. They bring into existence new models and facilities that makes it possible for the organization to execute most duties successfully. Now, in order to correct or change the failure or the weakness of this company, we will use the Ketter's 8-step change model. So, in an attempt to establish and foster change to improve the organization, it is really ideal to evaluate and adopt and also implement certified strategies that will substantiate the projected changes. Now, firstly, the organization should evaluate its performance trends from the past, the present, to the future, to see, to analyze the performance, and then to see whether they are moving forward or they are moving backwards. This can be done by the SWOT analysis. This provides clear information of how the entity has cycled through phases of development in terms of performance. Also, secondly, the organization should reinforce the existing partnership and look forward to forming more coalition with more advanced, credible, and visionary organizations. Thirdly, the visions of the organization should be made known to the workforce so that they know where they are going to. It will lead the workers and also the workforce to contribute fully towards achieving that goals and those visions. Fourthly, they should organize and focus on momentary targets. There should be short-term and long-term targets that should be put before the staff and also the workers so that they work towards achieving those goals. And lastly, they should establish changes as part of the system. They should match factors that enable the success and inculturate the successful value, principle, and behaviors in order to sustain the success. Identification of integration of the organizational principles and values. Now, Kaiser Permanente has been very particular with the principle of professionalism, that is, upholding the value and dignity of employees as well as ensuring the employees' performance is guided by the organization's code of conduct. Integration of this principle in organization performance ensures workers maintain the rapport amongst them and nature's teamwork. The possible challenges that the company will face to the suggested change and plan is that the organization is more likely to resist the projected change and plans that would not uphold their welfare, since they may inhibit their service performance, leading to overall organization's inefficiency. So, without merging the changes with workforce interest and needs, the changes may not take course. For instance, information technology perceived to displace significant doctor-patient interactions, or the physician's feeling of being alienated by technology. Now, predicted change and plan will demand for higher financial inputs. That is, when more human labor is included instead of technological inclusion, the predicted changes or plans will demand for higher financial inputs. Implementing changes within an institution, sentence usually financially involving, which therefore demands that the entity must make ends meet to raise the sum to implement the changes. Now, ways to align various subsystems to bring change to the organization. As I said earlier at the beginning of the presentation, it faced three main challenges, and the way that these challenges can be corrected is that the workforce should undergo special training on how to use the newly introduced technological devices in the organization. Also, the department which is dealing with the information technology, particularly the organization's website, should find viable means to permanently rectify the regular faults of the website. Also, the three organizations making up the regional entity, that's the Kaiser Foundation Health, the Kaiser Foundation Hospital, and the Permanente Medical Group, should enhance their services delivery mechanisms in more convenient ways. Now, lessons that can be learned or evaluated from the strategies that have been taken to solve the problems. Firstly, an integrated and complex health facility like the Kaiser Permanente has to encompass a standardized and reliable open path of communication, which has already miscast that they lack effective communication. Also, secondly, the leadership of the organization should strengthen diverse and dynamic models within the organization. As usual, the organizations are expected to do all these tasks. Okay, so my views on the proposed change is that for Kaiser Permanente to live up to its expectation, it has to integrate holistic approach that particularly advocates for reinforcement and fortification of its human task force. Thank you.